My name is Weng Cheu Yue. I'm from Singapore. I've been using a laser for about 8 years now. So I've been using it on a daily basis for many types of procedure in my clinic. I found out about the events through our local office from Sirona, and they told me that it will be a gathering of experts around the world. I myself, I think, still a lot to learn in laser dentistry. So what I want to do is really to come here to learn, and I want to hear from them, right, what is their thoughts and their ideas and their experience of application. So it's also a good time that I can bring forth and test my ideas against the top users of the world. Right, and if I can get accreditation, yes, from them, or if not, a feedback to say, look, you can improve it on a certain way, I think all is going to be helpful for me. Yeah. I have to really have a chance to talk to a lot of top users of lasers, researcher of lasers, teacher of lasers, and of course users of lasers, publisher, writers, authors of laser books as well, as he was just standing next to me now. So basically, I find the 445 wavelength very, very interesting. I think most of the laser that I'm coming in contact with has to be, especially for diode lasers, has to have contact before it can actually do the ablation. But for 445, being able to do it at a distance and more control, because I've been using hard tissue laser, and I understand when you focus and defocus, you have some different effect on the ablation. And if a soft tissue laser or diode laser can do that, I think there is a lot of advantage and opportunity, you know, for clinical application. Having the SIROLaser Blue in my practice, I think it gives us a chance probably to expand the usage of laser for more of my colleagues. Because I think being the small footprint, it can be in every room. And also with the 3 wavelength incorporated into it, right, I think it comes into application in multiple ways. Like for example, ablation, 445, very effective. Then 970 for the typical surgical application, and then the 600 plus for the biostimulation. I think, to me, biostimulation is the next thing for laser dentistry. It was going to change how we perform and how we view how tissue will heal. At the same time, you know, how we're going to help people get healthier, right? So I think it comes from that. And 3 wavelength in one, I think that's a fantastic idea.